Hello everybody, my name is Dr. Asa Frey, and today we are going to be talking about how to reverse acne. Okay? If we have never met before, I am co-director and co-founder of Clínica Back to the Garden, which is a chronic disease reversal center in San Juan, Puerto Rico. We focus and specialize in supervision by an experienced professional of water fasts. Okay, we have the only residential center in Latin America which specializes in medically supervised water fasting. We also have an outpatient clinic as well as our residential center. We have an outpatient clinic for patients to come and have individual consults as well as long-term health programs. So we're going to be talking today about how to reverse acne. Again, my name is Dr. Asa Frey. If you're just tuning in, we are going to be talking about how to reverse acne. First of all, if you know someone who has acne, now would be the time to share this video with them. If you know a child with a parent who has acne or a parent with a child who has acne, please share this video with them. I know it's going to be of great help to them. So before we begin, I'm going to tell you guys a little story about myself, okay? Around age 14, I began having nodules underneath my skin. First, it started around the edges of my mouth, on my chin, and then I started getting small blemishes. Those turned into pustules from my nose to my forehead, my cheeks, my neck, even my back and shoulders. And I would say that it was pretty severe, right? Other kids had it more severe, but then again, I did not want to be one of those kids with acne. I wanted to have healthy, great-looking skin, right? Sometimes acne can be very painful, and it does kill a young teenager's confidence, right? I would avoid social gatherings. I became very angry with myself as well as everyone else. Luckily, most of the kids my age had acne also. So this helped a little bit. But again, I didn't want to have that issue. I wanted to have great looking skin. I tried everything except for drugs and other harmful treatments because that was just how I was raised. Okay, I was at CVS virtually every other week looking at a new product that I could bring home and try. Of course, none of those products work. And I did try to change my diet significantly. I wouldn't call it significantly. My diet now is a radical change from what I used to eat. I got rid of, typical foods that people think cause acne, things like pizza and hamburgers and bagels, sodas, greasy foods, things like that. But by no means was I eating a healthy diet, right? I did read a lot of information on the internet about foods that you could eat to help inflammation and specific things that you could do to reverse acne. Most of it was complete nonsense, and a lot of what I was reading was telling me specifically that diet has nothing to do with acne, which is complete nonsense. And we're going to go over some incredibly important information today that will help you, okay? Now give me a thumbs up if you guys know someone with acne. Just write their name in there, share this video, and give me all the participation you can because people need to hear about this. After living for 12 to 15 years with acne, there was really not one day during that period, not one day where I had very, completely clear skin, okay? And as you can see, now you would never know. You would never know that I used to suffer from acne for, 12 to 15 years, okay? I don't have any scarring. Those scars have disappeared. I don't break out anymore. I just love having clear skin all the time. So what exactly is acne, right? Acne is a chronic inflammatory skin condition resulting in pimples and pustules and nodules. It is not a physically dangerous condition. However, I can tell you, after being affected greatly for almost 15 years with acne, it can cause depression. Thank you. Very nice. Darlene, thank you very much. I like hearing that. I would have loved to hear that when I was 15 years old, right? It makes sense that it's hard to feel good about yourself and about others when you don't look your best, right? It's hard to feel good when you don't feel good about yourself. Acne is not normal, right? Not normal. This is a disease state. Yes, it's very, very common in industrialized societies, right? 85% of adolescents living in an industrialized country have acne. However, there are so many societies all over the world where acne virtually does not exist, right? It just doesn't exist. We don't see it. And what we do see in these societies where they have no acne and very clear skin is that they are eating what we call a traditional diet. What do you guys think a traditional diet is? What's a traditional diet? It's a diet that is based in complex carbohydrates, potatoes, rice, beans, things like corn, okay? Acne is very much a product of our modern living environment. So what you get is you have a chronic process of inflammation. So you have chronic inflammation and an overproduction of sebum by the sebaceous gland, right? So the sebaceous gland sits just under the first layer of the skin, and it brings an excess of fatty sebum into the pores and into the follicle. The follicle then gets infected, and pustules form due to the excess sebum and the bacterial growth that feed on the excess, right? What causes the overproduction and inflammation, right? I'm always talking about cause on here, but essentially that is part of what we do, so it makes sense that I would talk about that a million times during every one of my lives. What is the cause of the overproduction and the inflammation, right? Does this make sense to everybody? If you have any questions, just spit them out. A common theme among all inflammatory diseases is the presence of excess. Inflammatory conditions, we're talking about inflammatory intestinal disorders, inflammatory bowel disease, ulcerative colitis, arthritis, many other autoimmune conditions begin with this excess of inflammation, okay? And there's certainly tons of products out there that you can buy that claim to decrease inflammation. Oh, just drink your ginger tea and take your turmeric pill every morning, and then take a non-steroidal anti-inflammatory when you have pain to get rid of this inflammatory process. But of course, those things don't address the cause of the inflammation. So let's talk about the overproduction and inflammation of the sebum and the sebaceous gland. So where does this excess usually come from? Well, typically, where do you think it comes from? That's right, the food. It comes from the food that you're eating, which is what? Is a Western diet. It's a rich Western diet. Pay attention to that word rich, okay? There are other factors also to consider. However, from my experience, by addressing the excesses coming from the diet, we can see results very, very quickly. So what are the excesses, right? Well, let me give you an example. Let's say that we wanted to create really terrible acne, okay? You didn't have enough already, and you wanted to just cover your whole face and body in acne. What would you do? Well, this is very simple. You would eat a very high-fat diet, a diet which increases sex hormones, a diet which increases the amount of inflammatory chemicals. What chemicals am I talking about? This is arachidonic acid, casein, which is a protein specifically coming from animal product, insulin-like growth factor, estrogen hormones, and cholesterol. Okay, all of these are present in high amounts in what? In what? Cheese, that's a great answer. Yes, cheese has all of those things. So we get a high-fat diet, which is very high in sex hormones, which increases and stimulates the amount of hormones that you create, right? And this diet also stimulates a bunch of arachidonic acid. You're also eating a bunch of casein. You stimulate a lot of this protein called insulin-like growth factor. These products also come with estrogen hormones from the animal. And, of course, they're animals, and so they produce cholesterol. So you eat cholesterol. Just 2 cups of milk per day will raise the prevalence of acne by 40%. That's 40%. Okay, just 2 cups of milk per day. Most people most people drink 2 glasses of milk a day, which is far more than 2 cups. What do you need to quit? Right? What do you need to quit? This is a very easy one. I just named all the things that you don't want to increase and stimulate in your body. So what should you stop eating? That's right. You should, number 1, you should quit dairy. Stop eating dairy, milk, cheese, eggs, milk, cheese, butter, yogurt, ice cream, anything that comes with dairy. Chocolate also has milk in it. Okay? So number 1, quit dairy. Number 2, quit eating meat. Okay? All kinds of animals are meat. It's not just cows. You got cows and chickens and pigs and fish. You got horses and alligators and sharks and elephants, right? These are all animals, okay? Meat is meat. Or I should say dead decaying flesh is dead decaying flesh, no matter where the animal, where the species came from. Number 3, yes, I like your thumbs up. Keep them coming. Again, if you know someone with acne, share the video, okay? Share it with them. This can certainly help them. Number 3, quit eating eggs. Eggs are a very, very dense ball full of cholesterol and hormones and saturated fat. Okay, it's really not a good source of nutrition, except if you're a chicken fetus. Then it's a great source of nutrition for you. Why does this work? Okay, we said quit dairy, quit meat, quit eggs. Why does this work? Well, the less animals that you're eating, the less fat is in the diet. And the less fat that's in the diet, the less fat is on the skin, right? This can change within a few days of eating a low-fat diet. The amount of fat and oils and sebum production on the skin will get less, especially animal fat. Eating less meat will mean less animal protein, right? You quit dairy and eggs and meat, and you're not going to be eating any animal protein, which means less casein. Okay? This also means less arachidonic acid, less inflammation. This also means less insulin-like growth factor, which is a protein highly associated with many cancers, as well as acne and many other chronic illnesses. So overall, you get less hormones in general. How does this differ at the time of the month for females? Well, females create specific hormones during specific times of the month. They are certainly more prone to develop slightly more of these growth hormones, during their menstrual cycle. However, you still shouldn't be eating a bunch of things that create and stimulate extra hormones and proteins and products which create extra growth, right? Stimulating cancer cells as well as the root cause of acne. Does that make sense? Doctora Darlene Flores, by the way, next week, I believe my wife, Doctora Joanna, will be talking about how to create a pain-free, problem-free menstruation. So stay tuned for that. So, where are we? I would also recommend, right, we have meat, dairy, and eggs, 1, 2, and 3. And then there are also other things that you might want to stop eating, including oil, sugar, flour, and salt. Oil, sugar, flour, and salt. So oil, sugar, and flour are ways that we can artificially increase the amount of calories that we take in during the day. Okay? This is based on caloric density. I could talk about this for another 5 hours, just explaining how caloric density works. But basically what it is that these are very processed, highly processed foods, and during the processing of the food, you can artificially increase the amount of calories per pound of that food. Okay? If you're interested in that, read a book called The Pleasure Trap by Dr. Goldhammer and Dr. Douglas Lyle. So what do you do? What do you do? Is this a paleo diet? No, this is not a paleo diet. Paleo diet, certainly would allow you to eat tons and tons of animal products, right? Paleo diet is pretty much, if you read Lauren Cordain's book, he's telling you to eat at least a few servings of meat per day. which is going to, number one, increase the amount of fat in your diet, especially saturated fat, increase the amount of casein in your diet, contribute to arachidonic acid, which is going to increase the inflammation, as well as stimulate your body to produce insulin-like growth factor, which is a protein that is highly associated with cancers, as well as acne and many other chronic illnesses. This is not a paleo diet, okay? So what do you do? Guess what you would do. Well, you get on what is called a whole foods plant-based diet. Now, at our clinic, we do take it one step further because we basically like to do what we think is best for our patients and not what is less bad. Okay, just because something is less bad doesn't make it good. Okay, so we promote a diet which is exclusively made of plants, not a plant-based diet. This is a diet that is exclusively made of whole foods, plant products, which means a very, very high amount of fruits and vegetables, whole grains, beans, roots, a small amount of nuts and seeds. So that's number one, right? Get on a whole foods, plant-based diet. So, number two, this works because antioxidants come from where? Where do you guys think antioxidants come from? Do they come from eggs and from meat and from cheese? Come on, where do they come from? Antioxidants come from plants. The most dense source of antioxidants you can get are from fruits and vegetables. Okay, you also get a huge increase in phytosteroids, which are plant hormones, phytosterols. And you also get an incredible increase in dietary fiber. Okay, and all of these things have been shown to decrease inflammatory biomarkers in the blood. Okay, this is from a study by the Public Health Nutrition Journal just this year in 2017. And there's many of these studies, but they're basically comparing a diet that's vegan or vegetarian, really, so they're still eating dairy product and eggs, to a diet where people eat high amounts of animal products, specifically meat. And they're able to see a significant decrease in the inflammatory biomarkers. Pretty simple study. If you want the link to that, just let me know in the comments. So, most of the patients that we see, yes, Yolanda Torres, veggies, fruits as well. There's plenty of antioxidants and free radical consuming chemicals in fruit. Most of the patients that we see come here with severe acne. They either come here with severe acne, or they've tried every treatment and product and dangerous medication, and they're just not seeing any results. They've also tried many different diets, including the paleo diet. We see many people come in here who have been for years on a paleo diet, and well, they're doing worse than when they started. I'm not trying to speak ill of the paleo diet per se, because there's lots of things about that specific diet which are good. Right? They do promote a large amount of vegetables, which is a very positive thing. They also say not to eat dairy product, which is a highly processed food. They stay away from processed foods as well. But just because something is less bad doesn't make it good, again. So, at this point, when people come to us with severe acne, nodules and pustules and terrible scarring, with these patients, it can be very beneficial to do a what? A water fast. That's right, a supervised water fast with an experienced professional who is monitoring them on a daily basis, a few times a day, and they are in a controlled environment. Okay? At this point, a supervised fast can be incredibly beneficial. Water fasting can be quite helpful in addressing these causes and providing the correct environment for the skin to recover. Resting the internal skin, right, the endothelium on the inside of the intestines, right, because we have an inner lining to the intestines that starts inside the mouth, goes down the esophagus to the stomach, small intestine, large intestine, right? It's called the endothelial lining. During a fast, we get to rest this, correct any intestinal microbiota imbalances or bacterial overgrowths, allow the body to process, metabolize, and eliminate inflammation and harmful byproducts of metabolism. It's a little bit confusing. If you want to learn more about basically everything I just said, go watch my previous video on fasting, five reasons to do a fast. I think it was 4 weeks ago. Go watch that. It will tell you in much more detail some of the detoxification effects and a lot of the other beneficial effects of a water fast. So you give the skin the rest that it needs to rectify the situation. Now, concerning chronic skin issues, water fasting turns out to be a surprising answer to a number of difficult questions. So, in summary, okay? And if anybody has any questions, just spit them out. I'll try and scroll through and answer them. Please don't get upset if I don't answer your question. I miss a lot of questions, and sometimes there's just not enough time for me to scroll through and answer you all. So, what to do? In summary, if one of you guys want to give me a summary, go right ahead. What to do? Stop, number one, stop causing the problem, okay? We'll scroll back up here and stop causing the problem, all right? Stop ingesting chemicals that are going to make your acne worse, right? It's very simple. If you want to create acne, if you wanted to get tons of acne, you would do as such. You would eat a high-fat diet, which increases the amount of sex hormones in your body. You also increase the amount of inflammatory chemicals such as arachidonic acid, casein, insulin-like growth factor, estrogen hormones, as well as cholesterol, right? Cholesterol just happens to be a major component in sebum, right? Sebum is the substance that you secrete onto your face that clogs the pore. A lot of that is made up of cholesterol, so it makes sense if you stop eating cholesterol, then your acne would benefit greatly. So, in summary, we said, quit doing the stuff that causes your acne, right? Number one would be quit dairy. Number two would be quit meat. Meat includes any type of animal. Dairy is not just milk, right? Cheese is made of milk. Yogurt's made of milk. Ice cream is made of milk. Butter's made of milk, right? There's tons of different fancy dairy products, whether you coagulate it into cheese or ferment it into yogurt. It's still, a lactation secretion from a large bovine animal that needs to grow from a 40-pound animal into a 500-pound animal in about 6 months, okay? Cows grow about 40 times faster than humans, right? So when you drink cow's milk, things are going to grow, right? And not only the good parts, right? Also the cancer cells and the promotion of acne and other growths like cysts and fibroids. So you quit dairy, quit meat, quit eggs. Number four, right? You quit oil, sugar, and flour, which increase the amount of calories that you're eating. Number five, you quit salt, okay? Excess fluid from salt is probably not something you want to hold on to when you're battling an inflammatory condition, right? You want to get rid of as much excess fluid and inflammation as you can. Does that make sense? If you had rheumatoid arthritis, would it benefit you to be eating a whole bunch of salt, right, that swell up the joints and the connective tissue? Probably not. No, you want to get rid of salt, let all that fluid exit the system. If I'm being too confusing, just tell me to stop and we'll move on. So, number one, you stop causing the problem, right? You find a physician who is willing to take the time to investigate and find out what the cause of the problem is and then address it, right? Absolutely quit dairy immediately. Get on a very high fruit and vegetable diet with, try to eliminate all processed food, right? Oils, sugar, flour, and salt. Try to just get rid of those. At least minimize them. If that is too difficult for you to do, because it is, radically changing your diet from an unhealthy diet to a healthy diet tends to be hard for people. It's difficult, right? They have a hard time doing it and sticking to that. So if that's too difficult for you and you're just not getting the results that you want, it would be incredibly beneficial to do a water fast, okay? A supervised water fast with skilled health professionals who have experience in water fasting, okay? For more information on our programs and our residential center, please visit the website Back to the Garden PR, Okay, all the information over our services as well as the residential center are on that website. Yes, it's in Spanish, but you can easily Google Translate that. It comes out very nice. So now I'm going to take a couple questions. I've been talking for, well, too long. I've been talking for too long. Let's see what you guys have for me. Is what safe for teens? I'm not sure what you're talking about. Is a healthy diet safe for teenagers? Yeah, I would say no matter what age you are, you want to be on a healthy diet, right? Doesn't that make sense? Okay. What else? Yeah, of course, Gabby Luciano Rodriguez. I'm leaving this on the page, so just watch it anytime you want. Okay, I also have 3 previous videos. Okay? Anyway, if you guys appreciated this information, give me a thumbs up. Let everyone else know, okay? Share this video with other people who have acne, whether they have acne or not, whether they have other chronic skin issues like psoriasis, eczema, vitiligo, alopecia. Share this with them. Thank you guys for coming out and listening, and we will see you next time. Oh, I have one announcement. On the 24th of September, septiembre 24, tenemos una charla. So we have a lecture on the 24th over intestinal health. Okay, so we go over the physiology of the intestines, and we go over how to achieve a healthy microbiome inside the intestines. Okay, this is a wildly popular theme. People are buying and selling a lot of probiotics and fermented foods and kombucha, as well as sauerkraut, and we're going to go over this topic in detail so that you guys can make an informed decision about what it is that you put inside your mouth and in your intestines. Okay? Thank you very much, and we will see you guys later. Bye-bye.